I wish that we had time to do these in post-conference. Okay, newborn. What I did here, you guys, is nothing magical, but it can actually do magical things for you. I put in bullet points things that you really needed to know and put it in a game form. Y'all are familiar with Family Feud, right? See, if we played this, if we did this in post-conference, this is what we would get to play. I can see you all are very impressed with that. So anyways, I get impressed with it. So, but it makes it fun. Learning needs to be fun, okay? But when you're by yourself, you don't have to play that unless you kind of want to just, pretend you're really on Family Feud. That's fine. Now, if you do this by yourself, okay, just try and do the best you can, have as much fun with it as you can, but here's what you're going to do. Okay, so you got to know APGAR, okay? Have to know APGAR. And what I suggest is you need to know, APGAR. I know it's written a couple of different ways in whatever resource you look at, but you need to be able to name what is evaluated in these. So we've got activity, and with activity, that's muscle tone, pulse, grimace, which is reflex irritability, appearance, which is color, and respirations. Now, some of you might be learning it a different way, and that's okay too. As long as you know it, I don't care. So there's a couple of things here. Know that 0 points, everything just about is absent. Okay. Everything is absent, flaccid, bad, 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 right? 2 points, perfect, 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 perfect. So the 1 point is going to be somewhere in between. So pulse is absent. Pulse is over 100 for 2. So below 100 is going to be 1 point. Okay, so you kind of have an idea of that. Now, the other thing I want you to have an idea of is, what does activity mean? Activity, muscle tone. So for a newborn, muscle tone is just that. They've got their legs flexed, their arms flexed. They're not flaccid, right? They're moving and they're flexed. So pulse is pulse. Grimace is, think of the face, a grimace, okay? They're frowning, or when they're crying, they're frowning, okay? And if they're crying, I could put a 2 there, right? Because if they're crying, they're going to be flexed, usually. So I could put a 2 there. Action, motion, sneeze, even though we're doing movement up here, sneeze, cough, pull away. Okay, they're moving. When we get down here to respiration, if my baby is coughing, sneezing, moving around here, and it likely is doing a-okay down here under respirations, okay? So I might give you, 4 things, and by the 4 things I give you, you've got to figure out what the other one is and what it would be, okay? And I just told you exactly how to do that. And obviously, if it's severely depressed, resuscitate. With a 6, we might be able to just stimulate. But with 7 to 10, we basically stimulate, dry, suction maybe. Okay, probably doesn't need a lot of O2 whiffs. Okay, the next one on our list is the Ballard gestational age. So there's a chart at the end of these pages. This is what you looked at in Skills Lab days, and I had you learn. And although the hospitals don't typically use them, neonatologists would use them to help determine gestational age. If there was a question about dates, the obstetrician would use it. So it's one of those things that is still used that we need to understand. So here's what I want you to know. Neuromuscular maturity, there's 2 categories, and physical maturity. So neuromuscular is just what it says. It's the nervous system and it's the muscular system, okay? And then an example would be fully extended limp posture. Posture is one of the things we evaluate, and it would either be fully extended limp would be less mature, like a little preemie baby, or flexed would be more mature. So what I want you to know is what's more mature, what's less mature. How would you recognize a more mature baby? How would you recognize a less mature baby? Now, I do not want you memorizing numbers, okay? I mean, you looking at it, you can tell the zeros are the preterm ones, the fours, threes and fours are the term, but I'm not going to ask you to memorize numbers. I'm just going to say, hey, this baby looks like this. Would you say it's more mature or less mature? Okay. It would just look like a preterm baby or just look like a term baby. And then, of course, why we perform the Ballard assessment, gestational age assessment. Then we have physical maturity. So again, what's more mature, what's less mature? So lanugo that is abundant, means a lot of it, they look like a little monkey, is less mature. They haven't shed that lanugo. A balding would be more mature. Now, this is one that sometimes people get mixed up because lanugo, before it starts to grow, before the baby even gets to the point where it starts to grow, baby has that very translucent, shiny skin, and they don't really have lanugo. So that's a really preterm baby. But I'm not going to trick you and say sparse lanugo or balding lanugo, okay? Because I really do want you guys to understand this and to get it. It's not a trick. I want you to get it. Let's see if there was something else I was going to say about. So then, yeah, physical maturity goes through a lot of different areas. Back up here at neuromuscular maturity, basically the preterm babies joints, they move, their arm can wrap around them, their foot can wrap up to their, or be brought up to their ear. But the one joint that doesn't move well in the preterm infant is what joint? I'm going to let you look that up. There is one joint. A full-term baby moves much better than a preemie. You will see on that chart, when you look at the chart, a preterm infant, their wrist will do this, about what ours can do. Okay. A full-term infant, let's say that they look like this. Okay. This is their wrist, and it's almost like a hairpin. Okay. So there's more mobility in the full-term infant's wrist. All right, so that varies a little bit. Then physical maturity. You can look through those. What's more mature, what's less mature? Let's keep going. Name vital signs in the newborn. This is a newborn. And what you got to think about with a newborn is that their liver is immature, and they have more than enough red blood cells typically from mom when they're first born that they have to get rid of now on their own. They don't give them back to mom. So their liver is immature, and so the liver has a little difficult time conjugating the bilirubin, breaking down the red blood cells, conjugating it and excreting them into a water base to excrete. They either excrete it in the stool or the urine. So they have a hard time excreting it. So their bili is higher. So about a 6. Okay. It's not just 6, but I'm going to put 6.0. Now, blood sugar on a baby, some will say 40 to 42, right? Isn't that what you guys have heard? These, I think, are pretty much what we need to identify in the newborn. Okay. All right. 4 common rashes or rash-like appearances often found in the newborn, and describe them. So we've got these different rashes: milia, miliaria, erythema toxicum, mottling, cutis marmorata, and understand what causes them, and patient education, because sometimes if it's a new parent, they get worried about them. It's like, what's going on with my baby? Okay. All right. Then we have 4 most common newborn birthmarks, and describe them along with patient education. Okay, so then we go through and make sure you look at your slides really well on this. Learn those well. They're not hard, but like anything, you just got to learn them. Hemangiomas. We know that heme means blood, and because of dilated blood vessels from the estrogen, baby can oftentimes get these pink or red birthmarks. So hemangioma, flat hemangioma is just dilated capillaries that blanch. It's flat, so it blanches when they're pressed on. They disappear by 2 years. Strawberry hemangioma is raised. It's a raised one. Okay, then there's the cavernous hemangioma. Those are larger, they're more disfiguring, but they eventually can go away too, but sometimes it takes up to 10 years old. Nevus flammeus is also known as a port wine stain, does not blanch. It is a dark purple, dark reddish purple that does not blanch. Okay, cafe au lait spots, permanent light brown areas, Mongolian spots, pigment cells, that melanocytes that occur more commonly in darker skinned people because they have more melanin in their bodies. So just like those people, when they're pregnant, they can get brown spots more easily. The chloasma, the linea nigra, all of the, the brown spots that occur during pregnancy. All right, then we have behavioral assessments. And these are not periods of reactivity or sleep states, but instead think how the infant is behaving. You guys did this in your essentials worksheet. You also did sleep states, but this is behavioral assessments, how the infant is behaving. So you can look through these. We've talked about these in class. Now we have the 7 deviations of the fetal head or face that could potentially be present after delivery. And we talked about these in class also. So the thing you would need to remember with these is, what do they look like? How would you identify them? And what patient education you would tell mom when they see it and freak, okay? All right, if the newborn appears to be grunting, we talked about this. Name 5 nursing assessments you would initiate. Well, you think about grunting, and what is grunting? It's the baby trying to hold in air so that the alveoli stay inflated. So it's actually a respiratory distress sign. So us knowing that, parents think it's cute, us knowing that, we want to evaluate all of the vitals of baby, including blood glucose. Okay, name the common causes of low blood sugar. As I said before, you guys, anything that puts stress on the baby can lower the blood sugar, anything. So if a baby is asphyxic inside, UPI, and he's got late decelerations going because of it, you know what, when that baby gets out, we're going to do blood sugars on him. If the mom has diabetes, we're going to do blood sugars. Terbutaline can increase blood sugars, actually. And then any of these post-maturity, prematurity, cold stress, all of that, increased metabolism of blood sugar, okay? So, and we got to make sure that that baby doesn't bottom out on the blood sugar, because that can cause what? What do we all need in our brains all the time? We need glucose. And we got a lot of it some people got a lot of it during Halloween. Me, I eat my, you can't see it very well because I'm packed. I eat my organic stuff, and I always have it right by me while I'm working on your stuff. And I tell, by the way, now that I'm at this point, I always tell you guys too, when you are ready to take an exam, I know it's hard to get sleep though, got to get sleep, can't think straight, and eat a protein breakfast. Hard boil an egg the night before and eat it on the way to school if you need to. Eat some chocolate before you take your exam, and those things can help. Breathe, in and out, real good during your exam. Get the oxygen going to the brain. So back to blood sugar. It's sort of like when you and I haven't eaten for a long time and we get cranky, okay? And we get a headache, our brain doesn't feel good, we get cranky, jittery. It's low blood sugar symptoms. And so we know that a baby that has had an increased metabolic stress going on, their blood sugar is going to drop and we need to check it.